Hi everyone, my name's Adrian Richards, I'm a plastic surgeon, and this is Libby, who's our chief trainer and injector at Cosmetic Courses, and also works with us at Aurora Clinics. So we're going to be running through a few questions today that we've actually had from our delegates, haven't we, Libby?
We have, we get quite a lot of questions. And,
how many do you get?
On average, I'd say that we probably get about 10 a week.
Yeah.
Yeah, through one way or another, email or telephone, your line.
Yeah. It takes you a bit of time to type your...
Yeah, you know, I'm slow on the old typing, so that way this might be a bit better for me.
Yeah. So anyway, so what we're going to do, we're going to play some of the audio questions we've had on our audio line. So we've got an audio line that you can ring and leave questions on. They come straight to myself and Libby. We'll get back to you, but we also normally use the recordings to answer some of the questions that we're going to be doing in these videos. So should we listen to one?
Let's have a listen.
Well, I did my training with you in September 2010. I've just got a query about a lady who's got a bruise when I did her treatment 2 weeks ago, and she's contacted me today to say that she's still got the bruise. So I just wondered if you had any advice, really, what I can tell her to do about it. Thank you.
So Libby, a bruise 2 weeks ago, is that common? How can you avoid it? How can you, if you get one, how can you treat it?
Well, yes, a bruise is fairly common, I would say. I think even the most experienced of practitioners experience bruising with their patients. And sometimes we can avoid this by making careful patient selection. Sometimes our patients are on things, medications which affect their bleeding time, which we wouldn't particularly pick up on, like vitamin supplements, and I think you've seen this in theatre as well. So sometimes they forget to tell us that they're on vitamin E, St John's wort, other homeopathic medicines. So look out for those when you're doing your patient consultation. Obviously, careful injection technique is important, so speed, I think, is really of the essence. You don't want to sort of force any product in. Sometimes you don't even see any bleeding, but if you've been very quick with the injection, the filler material expands onto a capillary and can cause a bruise subsequently so that you might not have seen. Now, if you've got a bruise, obviously you need to deal with it because the patients are not very happy about that. So, you know that the makeup, obviously, but that doesn't suit the gentleman usually. So, I usually say that when there's no possibility that bleeding is still taking place, probably 48 hours after treatment, I would ask them to keep cold compress on for 48 hours to just make sure.
48 hours?
About 48 hours to make sure everything is stopped.
All the time? 48
Not all
hours?
the time, a few times a day, you know, morning and night, just a couple of times a day.
That's not going to look good?
It's not going to, no, not going to look good. They can do it in the morning, they can do it in the evening, and at lunchtime maybe.
Okay, so I do an injection, okay? I know, that's how we do Botox. Common places to get bruises around
the
here.
eyes.
I know immediately if I get blood coming back, I've got a bruise. What do you do straight away, Liz?
Pressure.
Yes.
I would get the patient to put pressure on the area.
And Libby, that means pressure. That doesn't mean pressure for 10 seconds, take it off and have a look. It means...
I would probably say leave it on there for a good 10 minutes before you have a look. A good pressure with, you know, you can always ask your patient if you still haven't completed treatment on the other side to hold a compress to their eye while you go around to the other side.
Yeah.
Then have a look.
Then have a look. So if you get one here, carry on, get them to press on there, and then afterwards. So after 5-10 minutes, you take it off, there's no bleed, if there's a little bruise, what do you do then?
Well, I would always put arnica gel or something like that on, or maybe Orogen, that nice cream we use after a facelift, I would use that. Or arnica gel, when they go home they can put a bit of a cold compress on there. After 48 hours, then I would say they can put a warm compress on a couple of times a day to help speed up the breakdown of the, you know, the old blood.
So after 2 weeks, Libby, do you think that's normal, have a bruise?
I wouldn't be wanting to see a bruise after 2 weeks, but myself I've experienced bruising up to 3 weeks following treatment, so I think it's, you can...
Your own personal treatments from you?
Oh no.
Yeah.
Treatments that I've had to myself.
You've done.
Yes.
So someone's done on you.
Yeah, someone's done to me. I had quite a significant bruise for about 3 weeks following the treatment.
Was that? Do you mind?
It was here along my cheek area here, and did look like a black eye. But we're lucky here. If people say, "What's that bruise?" I can say, "I'm just trying out a product for you." But it doesn't work in everybody's workplace.
So You can get, I mean, basically a bruise is blood within the skin. Normally would go away. You can do Oroderm vitamin K to improve it, but you do sometimes get some hemosiderin, which is the leftover product of blood in the skin, which is sort of browny. So rather than having a bruise, you can have brown pigmentation in the area that can go on a bit longer. Normally get it around the eyes. So really the key is try and avoid getting the bruise in the first place. If you do hit a blood vessel, pressure, treat it early, and then use the other treatments to try and speed up the resolution of the bruise absolutely as quick as possible. And I suppose don't do it again.
Yeah, treat that.